Good morning to everyone, to Pepe Mejia, who joins us today, to the sign language interpreter and the audience tuned in to this briefing. Today, we report 8,547 hospitalized patients, 6,738 under medical supervision, 1,232 are suspected cases, and 577 are confirmed active cases. Yesterday, over 7,000 samples were processed, 7,625 at the molecular biology laboratories of our country, 1,906 at the Tropical Medicine Institute Pedro Coury, 965 in Havana's Hygiene, Epidemiology and Microbiology Center, 884 in Villa Claras, and 416 in Santiago de Cubas. 564 samples were processed in the Genetic Engineering and Biotechnology Lab, 548 in the Naval Hospital, 423 in Hermanos Amejeiras Hospital, 403 in the Center for Molecular Immunology, 373 in Manuel Fajardo's Hospital, 337 in ICA's laboratories, 332 in Fructuoso Rodriguez Hospital, 277 in the National Civil Defense Labs, and 207 in the National Center for Genetics. As a result of the analysis and processing of these 7,625 samples, 40 people tested positive for COVID-19. This brings the total number of samples processed since the pandemic began to 569,371, of which 5,310, or the 0.93% of people, have been diagnosed with the virus. Samples from all of the country's provinces were tested depending on its epidemiological complexity. Havana processed the most with 4,662, Mayabeque processed 111, Matanzas 409, Villa Clara 199, Santi Spiritus 104, Ciego de Ávila 955, Camagüey 548, Holguín 116, Santiago de Cuba 243, and so forth from every Cuban territory. The 40 diagnosed cases yesterday are Cubans, 39 are autochthonous cases, and 1 is imported. This is a person that recently arrived to Cuba, was directly taken to an isolation center where he was diagnosed with the disease, hence it does not affect the residence province incidence rate. 37 of the 40 cases, or the 92.5%, are confirmed case contacts, and we reiterate the significance that this risk group entails. All patients had been previously isolated for being a confirmed case contact. Inasmuch every positive case is investigated, all of their contacts over the last 15 days are traced and taken to isolation units, where they're properly treated and undergo a PCR test in order to rule out or confirm the disease. This figure therefore means that the 90.5% of all diagnosed cases in Cuba have had contact with someone who had previously tested positive to the virus. The source of infection linked to 2 patients is yet to be determined. Hence, this figure stands at 62 patients over the last 15 days whose source of infection is being investigated. A lower number compared to yesterday, since there are patients that have recovered from the virus. As I mentioned, 1 patient contracted the disease abroad, but accounts for 441 people. 14 patients are male and 26 are female, for a 50.5% and a 49.5% respectively. 20 of the 40 patients, that is a 50%, were asymptomatic at the moment of the test. The figure stands at 66.8% over the last 15 days. That is, the 60% of all confirmed cases in Cuba up to date did not present any symptoms while being tested. I always highlight this characteristic of the disease, considering the fact that we are unable to identify the person who carries and transmits the disease while presenting an asymptomatic condition. 12 individuals are under the age of 20, of which 11 belong to pediatric ages, what stands at 577 patients diagnosed in this age group. The 85.6%, that is 494, are discharged and recovered from the disease. 6 patients are between 20 and 39 years of age, 14 between 40 and 59, and 8 belong to the 60 or more years of age group. Of the 40 diagnosed patients, 23 are from Ciego de Ávila, 14 from Havana, 1 each from the provinces of Artemisa, Santi Spiritus, and Camagüey. The imported case belongs to the province of Santi Spiritus and is from the municipality of Jatibonico. The 39 local transmission cases belong 1 to Artemisa from the municipality of San Cristobal. In Havana, 11 cases belong to 10 de Octubre, 2 are from Habana Vieja, and 1 from Centro Habana. In Ciego de Ávila, 22 cases belong to the municipality of the same name, and 1 case to Baraguá. In Camagüey, the patient belongs to Florida municipality. Therefore, Ciego de Ávila's incidence rate per 100,000 inhabitants continues to be the highest in the country, with 57.66. Havana's rate slightly decreases to 19.67. Matanzas lower than the day before, with 10.28. Santi Spiritus also lowered its rate to 6.44. Artemisa with 6.41, Cienfuegos with 0.49, and Holguín with 0.39 remain with similar rates as the day before. Mayabeque with 3.38 and Camagüey with 1.18 are slightly higher than the day before. Thus, Cuba's incidence rate per 100,000 inhabitants slightly decreases to 7.47. I will ask Lilian's support to bring up a map that shows Cuba's incidence rate per province over the last 15 days. In dark red, we have indicated the provinces of Havana and Ciego de Ávila, with more than 19.6 cases per 100,000 inhabitants. The orange color reflects the 4 provinces with a rate between 3.38 and 19.5, which are Matanzas, Santi Spiritus, Artemisa, and Mayabeque. And the lightest color shows the territories which incidence rate is lower than 3.31. We placed in here 8 provinces and the Isle of Youth Special Municipality. This chart was created with Diana's support in the Monitoring Center. Thus, 6 provinces and the Isle of Youth Special Municipality have remained free of COVID-19 cases over the last 15 days. These provinces are Pinar del Río, Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and Isle of Youth Special Municipality. Professor Fran Millán has also prepared a chart based on the new cases that shows a decreasing trend in opposition to the last figure of positive cases and the results obtained yesterday. However, I highlight it does not show a tendency as such, but presents a plateau of cases instead. With this analysis, of the 5,310 diagnosed patients in Cuba up to date, 577 are confirmed and hospitalized active cases, that is 10.8%, of which 570, or the 98.7%, present a clinically stable evolution. We did not report any deceased patients today, hence the figure of COVID-19 related fatalities stands at 118. This means that the island has a mortality rate of 2.22%, lower than the global rate of 3.06% and the regional rate of 3.37%. We always mention the two evacuated patients at the start of the pandemic. Yesterday, 31 patients were discharged from hospital, not a positive indicator concerning discharged diagnosed cases ratio. The 31 patients belong 13 to Havana, 1 to Artemisa, 3 to Matanzas, 11 to Ciego de Ávila, and 3 to Camagüey. Thus, Cuba accumulates 4,613 patients, that is, the 86.9% of all diagnosed cases in Cuba recovered from the virus. 2 patients are in a critical state, hospitalized in Camagüey. 5 are in serious conditions admitted to Camagüey and Havana's hospitals, and 1 patient reported as serious is now in a critical state. Concerning worldwide statistics, COVID-19 pandemic remains to be present in 185 countries. 281,515 people were diagnosed with the disease only yesterday, for a total amount of 31,658,573 diagnosed cases. 6,188 fatalities were reported yesterday, quite a significant number, what brings the global death toll to 971,869 and the mortality rate to 3.06%. The region of the Americas stands at the 50.28% of all cases worldwide, with 108,636 new infections and 15,919,539 cases. 3,383 deaths were reported in the region yesterday, nearly 50% of worldwide fatalities, for a total amount of 537,929 fatalities and a mortality rate of 3.37%. The United States continues to top the list of the worst affected countries by the pandemic, with 6,857,967 COVID-19 cases, followed by India with over 5.5 million cases, Brazil with over 4.5 million cases, and Russia with 1,109,000 cases. Turning the attention to the Americas region, right after the United States and Brazil comes Peru, Colombia, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, Dominican Republic, and Panama. Mexico and Colombia report over 700,000 diagnosed cases, Argentina over 600,000 cases, and Chile over 400,000 cases. We have indicated Mexico's mortality rate of 10.52% and Ecuador with 8.76%, being these figures the highest rates in the region. Thus, Cuba is placed in the 20th position in the region with 5,310 diagnosed cases up to date. This is all the information on the behavior of the pandemic in Cuba and the world.